3 things you can change now to reduce your risk of breast cancer. We are here today with breast surgeon Dr Krishnan. She's here from the SAN. Hi, Dr Krishnan.
Hi, Gia.
Thank you for coming today. These are such important topics. And I wanted to ask, what are these 3 things we can do right now to change our risk?
Really good question, Gia. The first is alcohol.
Wow, alcohol.
Reducing your alcohol intake. So 1 drink a day, up to 7 a week. Alcohol is linked with many cancers, and breast cancer is just one of them. The lifestyle risk factor number 2 would be obesity or being overweight. So you want to maintain an ideal body weight. And number 3 is linked to number 2, regular exercise.
Okay.
To maintain that body weight, and no binge drinking. Those would be the
yes.
3 things to do
That you can
today.
do yourself, that you're in control. So what about the things we're not in control of, so the risk factors?
Well, one would be the estrogen window. So someone who has who had their periods early,
Yep.
or they have late menopause, so they have a longer estrogen window, that tends to lead to higher risk of getting breast cancer. Past history of breast disease or breast cancer.
In the family.
And of
on
course, on yourself. And of course, cancer in the family, breast cancer in the family. And mapping out the family tree is very important, because we look at which side the cancer is on. And even paternal, your father's breast cancer can affect you.
Wow, okay.
And if there's a very strong family history, then you might go for a family cancer clinic and test your genes.
So tell us a little bit more about the genetics.
Well, thankfully, a very small number, only 5% perhaps, of breast cancers are due to a mutated gene. And you would have heard of BRCA1 and 2.
Yes, absolutely.
They're the
A lot of people
commonest.
do, yeah.
Everyone knows about BRCA1 and 2. So they cause an increase in not just breast cancer, but ovarian cancers as well.
Wow, okay.
So we detect them by checking women's family histories of how many patients with breast cancer in their family or ovarian cancer on one side, and that tells us of their higher risk.
Of their risk.
And they then present to a family cancer clinic, and based on that discussion, they might get tested. And if they're positive, then options are discussed with them. Is the option surveillance, intensive surveillance?
Yes.
Is the option medical treatment? Or is the option risk-reducing mastectomies? So that's a discussion that needs to be
For another
had.
time, yes, definitely. Thank you, Dr Krishnan. It was so nice to talk to you again. What great information we're learning. Please stay tuned for some more of these topics at Mums at the Table. And we want to thank you again for coming today.
My pleasure.
See you next time.